I've just found that this cage is intuitively just as simple as an ALIF cage. Once you get the idea of how this is supposed to be inserted off of that psoas border. I'm Todd Shanks. I'm a neurosurgeon practicing in Dallas, Texas. My surgical practice is neurosurgery, but predominantly I perform spine surgery. The ALIF, in my opinion, is probably one of the best procedures developed. Typically, the L4-5 segment is the most problematic level, and so sometimes you struggle and make compromises either with an off-position cage or trying to go with a smaller cage to get it in more midline. And I think it's an easier approach for surgeons to learn for themselves. We really don't need a straight midline on approach to get to this level because the entry point to the disc space is just off the edge of the psoas muscle. I think there's a versatility also in how we can position the patients. I've gone from the lateral position to even supine, but the entry being off to the left, going in towards the side of the aorta, which is a much safer corridor. It tends to also have a much larger window on most patients to get up to that level. But what I found the easiest part of is the lack of the mobilization needed at the L4-5 level. A lot of times, even when I'm doing my own approaches, I rarely have to take the iliolumbar, which usually you have to sacrifice to do an anterior or ALIF approach. There's been a multitude of cages I've used over the years, and the subtleties between the different cages always made it still problematic for me at the L4-5. So if someone has a very anterior iliac crest, most of these cages require a rotational hand motion to get the cages into good midline position. So if the crest is slightly anterior, you still can't get your hand worked around. But what's really unique about the NanoHive is the fact that the cage is designed to go in without any orthogonal hand movement, that I have a direct 45-degree angle right off of the psoas muscle, and I can place the cage with a direct insertion. And when the cage is in its appropriate position, it really looks a lot like an ALIF cage. The cage that we've been able to get in is typically much larger than most ALIF cages. So the visualization of this is dual. You can see directly off the psoas where you should insert this. And a 4-5 has always been traditionally the better insertion point because that typically aligns with what we've been using for our radiographic entry points. This cage is designed to go in at its entry point on the ipsilateral pedicle. And that's typically where the medial border of most of the psoas is on most people. So we'll place a T-barred stymie pin that is the length of the cage. And once we place this to get our visual orientation of the entry point to the cage, we can also now use this pin and where the tip of the cage is going to be in relation to the anterior, posterior, and lateral portion of the disc space. And that's what's great about it, because it's clean radiographic imaging and direct visualization to give you a good idea of how this cage inserts. The great thing about this cage is it allows relatively good restoration of that sagittal alignment, obtaining your lordosis, the same way we would with an ALIF cage without the excessive tissue mobilization and vessel mobilization that we need to do to perform an ALIF procedure. I think the ipsilateral and contralateral potential nerve injury is lower, especially in the risk of psoas syndrome. Most of our patients go home for single level the same day, or they can go home the next day for 1 and 2 level front and back fusion. My overall impression of the oblique approach is once you've mastered understanding your anatomy and your angles, this is a much easier approach than even performing an ALIF, just because we don't have to mobilize the vessels. These have been some very, very well-constructed cages. We've put in to date about 9 interbody cages with the oblique cage. To date, everyone has done very well with up to 4 months follow-up, already seeing fusion occurring in some. The cervical cages fit very well. The one thing I can say about this material is it fits very well and seems to have a very good grip inside the end plate without being too aggressive.